Welcome back. Well, today we have on Dr. Burton Eisenberg, and he is with the Hoag Family Cancer Institute. He's the Executive Medical Director. Welcome.
Thank you.
Nice to meet you. And really, primarily, what we're going to focus on today is the health center that is up in Irvine, just up the road, not too far up, and the fact that there are cancer services being added to the health center, right? Or maybe they've already been added.
Well, yeah, it's a very new facility. So the actual facility has been open for about a month now.
Yeah.
And we're still putting things in, and there's still some movement around the building. But so there are actually 3 buildings, brand new buildings in the health center at Irvine for Hoag. One of which is a cancer center. So this is an outpatient facility that is comprehensive in terms of services offered.
Okay. As far as the outpatient facility, would people still go somewhere else to have actual treatment done, or would this be ongoing treatment as well? And would you also diagnose there?
Sure. So most cancer treatments now are generally in the outpatient area, except for the surgical procedures, which sometimes require a hospital and inpatient care. But the cancer center in Irvine will offer full services. That is, there's a radiation facility there. There's also a facility for administration of chemotherapy drugs. There are physicians who will see patients and for the purposes of diagnosis and treatment. So this is a full-service cancer center, comprehensive in its intent. And the other buildings will be complementary, such that there'll be a facility for imaging, for other types of biopsies and diagnosis, and also a outpatient surgery center.
Okay, so this is great because we have something that's close by. It's just up the road, and of course the reputation of Hoag in general, but the fact that people don't have to go to Newport to get these services. Now, are you folks collaborating with other physicians and services within the area?
Yes,
the network, I should say.
So at least in the cancer center, we've had a collaboration with USC and the Norris Cancer Center at USC. Some of our physicians actually are from USC that come to Hoag for the purposes of patient care, trying to organize that generally around a disease site orientation. So doctors who have specialty in certain areas of cancer, say like lung cancer, some of those doctors are actually from Hoag, some are from USC. It's a nice blend of expertise.
And yourself, you're a professor up there, right, of clinical surgery?
I am. I'm a surgical oncologist, which means I do cancer surgery, and I am a faculty member within the Department of Surgery and professor of surgery at USC.
Great. So, good relationship.
Yeah, I'm the bridge.
You're the bridge.
I'm the bridge.
As far as the health center goes, a lot of services are offered up there, and the fact that it's just close by and easy to get to is great for a lot of patients. But now with this new cancer institute, it's a family cancer institute, so it's really for all ages, of course.
Of course.
But as far as the treatments go, would this, being that this is outpatient, would people, maybe people go to other facilities and things to get their treatment started, or perhaps had surgery, and they can still opt to go to the Hoag Family Cancer Institute as well? They have to maybe go through their primary care?
So I think there's a variety of ways that patients would gain access to a cancer center, some of which would go through their referring doctor, who would send that patient for a second opinion or for a workup or for treatment. The whole idea here is to bring all of that within the community.
Okay. You said it's just kind of getting going here. I know you're having kind of an open house coming up on Saturday, September 17th. When will you be fully operational, or are you right now, as far as the Cancer Institute?
So we are seeing patients right
Okay.
now. As a matter of fact, the radiation oncology facility at the Irvine Cancer Center is fully functional.
Mm-hmm.
We are seeing patients in the infusion room, and,
Okay.
and patients are getting treated. I think we're going to see a ramp up over the next several months of more physicians coming in, more specialty clinics being offered, and that's really the plan going forward. In addition to having a facility for patients to gain access to new cancer drugs, a specialized program for clinical research that patients often would have to travel to a major medical center in a large city to obtain.
So as far as the clinical research goes, there would be some trials that could be done there that people could sign up for?
Exactly. There'll be clinical research trials of new cancer drugs that will be available to patients in this area so they can be seen and treated near their home.
Yeah, that's fantastic. And of course, with your background and your connection with USC, I can see how this all kind of fits together here. You know, there's so many different ways that cancer is treated nowadays, and the different types of cancer. Not one size fits all, not what treatment fits all.
Right.
Would somebody come to the Cancer Institute, are they first going to be sitting down, no matter what stage that they might be in and what treatments they've already had, and sit down with somebody who can consult with them and figure out the best path for them to go?
Yeah, so one of the unique facilities of the Hoag cancer programs is nurse navigation.
Oh, okay.
What that basically means is we have nurse specialists who are in charge of helping patients navigate a very complex system of diagnosis and treatment. And we have nurse navigation for every type of cancer.
Okay, all right, which is obviously very important, but it brings some relief to people that they can go there and first talk to someone and kind of figure out what's going to work best from them. You know, it's going to be a difficult time for them at best, so they want to be assured that, you know, the path that they're going to go on is going to be the right one for them.
We want to make this as a easy experience as possible, even though this is a very serious problem.
Right.
Most patients have need for multiple different services, including support services like social work and nutrition and everything else that goes along with the treatment of the complete patient.
So that's all going to be
at the Cancer Center.
That's fantastic. So I want to remind people that if you're interested in going to an open house Saturday, September 17th, it's right up the road. Is it Los Olivos or that center there? I always forget.
It's on Shady Canyon, just across from Hoag Hospital, Irvine.
Okay, all right.
Right directly across.
Okay.
Plenty of parking, too.
Easy to get to. I was thinking of the other center up there, but yeah, I know where that is. I want to give you the website. It's very easy, hoag.org/cancer. And if you're interested, you know, in giving them a call, their number, very easy to remember as well, 949-7-CANCER. 949-7-CANCER, or again, the website is hoag.org/cancer. And again, Saturday, September 17th, come by for a tour of the new Cancer Center, and you can check it out. I think it's great. I think it's fantastic. And you oversee the whole Cancer Institute, am I right?
I do. The cancer programs in general.
Hoag, Newport, and Irvine. And
both. And I'll be there on the 17th. So
all right.
Like to meet everybody that comes in.
All right, you're a busy guy.
Yes.
Great. It's fantastic that it's just right up the road. Thank you for stopping by.
Thanks for
really
the opportunity.
Appreciate it. Dr. Burton Eisenberg, again, the Hoag Family Cancer Institute. The number is 949-7-CANCER, or the website, hoag.org/cancer, if you want to check that out. Thank you very much.
Thank you very much.
We'll be right back.